Hello again, everyone. Welcome to a new Monday. This is Marty Guthmiller, CEO of Orange City Area Health System, and we're going to be having our COVID-19 community briefing right now, 9th edition. I'm just going to start off today, and I'm solo today, so sorry about that. You're going to have to take what you get. I'm going to start today with our scoreboard that I've been typically providing. Not a lot of activity, which again is very good. The total number of tests that we've conducted is 57, with 3 positive tests. I think it's important to note also that we have not had a positive test since April 2nd. And so we'll talk a little bit more about that again, but out of our 57 tests that we've administered, 3 have been positive, and the last one was April 2. So we've had 54 negative tests, and that would leave pending of 0. So that is where we are as of right now. I thought I would talk a little bit about, while things are still quiet on the Western Front, as we say, as we've talked about before, we're not out of the woods yet, and I want to share with you what I've shared in the past regarding a website that we look at as IHME, it's healthdata.org, and I just got off the site, and here's the latest data from IHME, that Iowa's expected to peak on May 7. Actually, I think maybe the last time we talked about this, it might have been May 5. So it is May 7, 17 days from now. There are still estimated in Iowa 8 to 17 deaths per day from the COVID-19 virus. So that's through May 7. The good news is that at peak in Iowa, we would need a total of 580 beds, but there are 4,297 beds available. So certainly no deficit there. Again, at its peak in Iowa, IHME projects 148 ICU beds needed, and we have 246 ICU beds available. So again, no problem with bed availability or capacity in the state of Iowa as currently being projected. So but again, these statistics really require vigilance with the safety measures that we put into place regarding social distancing. And I thought, rather than just saying that today, that I just review very simply what some of those are. And this is out of a document, the CDC guidelines for opening up America again, which is you're going to hear a lot about, and we're going to talk more about opening up Orange City again in just a moment. But I thought it would be good just to remind us of ourselves of the basics here. Wash your hands with soap and water, or use hand sanitizer, especially after touching frequently used items or surfaces. Second, avoid touching your face. Third, sneeze or cough into a tissue or the inside of your elbow. Disinfect frequently used items and surfaces as much as possible. Strongly consider using face coverings while in public, and particularly when using mass transit, which we don't have too much of a concern about in Orange City. But in situations where you can't keep your 6 to 10 feet away from folks, can strongly consider using a face mask. I want to shift gears here a little bit now to kind of what our discussions have started here at the health system this morning as an hour ago. We do have some meetings later on today as well, so we can do our homework and figure out where we need to go with this. And this is shifting away from only doing emergent surgery to doing more elective surgery and procedures. One of the things that we have to consider, though, and think about is that currently Governor Reynolds' proclamation in Iowa bans all elective procedures through April 30. So that proclamation is in effect, and even if we decided to do surgeries tomorrow, which we're not, we could not do that currently because of the proclamation and the ban that Governor Reynolds has. That trumps everything in Iowa, including what the CDC indicates, or what CMS indicates as well. So I know there's a lot of discussion on that. Some of you may know that I'm currently chair of the Iowa Hospital Association, which means that my comfort level with getting information very quickly from the state through the IHA is pretty high, and I feel comfortable with that when Governor Reynolds eases the restrictions a little bit, which I'm confident she will do in the future. Probably not before April 30 though, but that we'll know about it, and we'll be able to bring that to Orange City, into this area as soon as we possibly can. Again, I like to go and kind of talk through this a little bit. Right now, we are banned from doing elective procedures. There's a little bit of a gap from elective on one side to emergent on the other. So how does that gap get filled? One of the things that we talk about is going from emergent to urgent, capital U. And there are some guidelines that we'll be talking about and following. What is urgent, and how is that defined consistently from patient to patient? Moving from a capital U of urgent to a lowercase u of urgent. What does that mean? So opening up the spigot a little bit more, doing a few more things, and then finally going from that to elective, purely elective. You know, and the truth of the matter is, there probably aren't a lot of cases that are truly 100% elective. Some of the things that you talk about in that might be a joint replacement. Okay, well, yeah, that's technically elective, but there are consequences over time. But a lot of times the definition is there harm to the patient in 90 days? And so maybe not with a joint replacement, maybe 90 days is fine. Although if you have been postponing that surgery for a few months, 3 more months might be get that into the urgent category, lowercase u. That's just one example. We'll be going through all of those scenarios beginning today and in earnest this week here at the health system. And we'll be coming out very soon with our own guidelines for opening up elective cases again. There's a lot of pressure from patients out there who are anxious to have their surgery done. We get that, but again, it's important to understand that our hands are tied currently until Governor Reynolds removes or amends that proclamation. Again, she's doing a great job. It's an appropriate thing to do at this point, but starting it back up again is not purely within our jurisdiction. One of the things I just wanted to remind you of also, because I think there's some misconceptions out there, that our clinic operations are open and ready to go. Just a reminder that to all of you that we feel we are safely providing services today, safely for caring for families. We are open and ready for business. Our environmental services staff is very well trained. They're doing daily sanitizing of the areas that we have people in. Our staff are screened. We have proper PPE. We're using proper hygiene. Most importantly, perhaps, we have not had a positive case in our hospital since April 2nd. And so that's way beyond any kind of 14-day measure or anything that anybody has out there. And again, that's in the hospital. That's not in our clinic settings. Our walk-in clinics are available on weekends from 1 to 9. Hospers, Mill Creek, and our Orange City Clinic are normal hours at this point. 737-2000 is the number to call for that with any questions, and they will get you triaged and sent to the right place. And we're anxious and ready to continue caring for all of you. I think that's it for today. I wanted to really emphasize the fact that we are reviewing when we can start up again with the so-called elective surgeries and procedures. We hear you. We know that you're anxious to get some things going. So are we. And we'll get to that absolutely as soon as we possibly can. So I'd just like to close today by again saying this little phrase that we've been consistently closing with, and that is stay vigilant, stay strong, stay healthy. Thank you again for joining us today.